Welcome to Treating TMJ, a journey to a pain-free life.
TMJ and Sleep Center podcasts. Now, we've gone through the process of identifying the symptoms, getting your consultation to find out a treatment plan, getting that treatment plan, and we've even heard from some patients about the results from working with Dr. Insolera and the crew at the TMJ and Sleep Center. One of the major components of this entire treatment plan is something we've hit on in several of the podcasts, but now we're going to really focus on it, and that's the physical therapy component. And Jamie, a physical therapist that works with a number of Dr. Insolera's patients, is our guest today. Jamie, thanks for joining us. My pleasure. Dr. Insolera, a number of even the patients we've talked to have talked about how important it is to follow this component of the treatment. And sure. How did you come to the conclusion that the physical therapy component was such an important thing in solving TMJ?
Well, that was kind of an easy conclusion because if you open an anatomy book, everything's connected. So, and then we've been kind of saying that. And you want to find a physical therapist that you can talk to, you can relate patients to, and this way we can discuss what the treatment plan would be for each individual patient. So not every treatment plan is the same. So Jamie will look at them, evaluate. She can get back to me with anything that she feels she wants to do, and we can talk about that. As a matter of fact, she has a whole list of people that we work with and we talk about, and we make sure the symptoms are, or the treatment is specific for each and every patient.
And I went through that analysis with you, Jamie, and so the process of figuring out, okay, I thought the two of you work quite well in tandem because you told me what to tell her and gave me x-rays and things to take with me. I had those on my phone, and then you went over what I'd gone through with Dr. Insolera and looked at the pictures on my phone, and were able to help me start doing the exercise I have to do at home. I'm making the motion of the bar that I have to do behind my back.
Yeah,
that's my very important one.
Back over it.
and That's really an important component, is the communication between the two of you, right, Jamie?
It is.
So prior to working with Dr. Insolera, was this something that you were focusing on, or has this been kind of a new journey for you?
This is a journey I've been under maybe 7-8 years.
Okay.
But I started focusing more exclusively in this population in the last 3 or so years, 4 years probably.
Yeah.
And the analysis that how did you guys come to work so well together?
Well, her winning personality, of course, and basically she was very excited about what we were doing, and she has a passion which I can respect because I feel the same way. So that's kind of the mutual thing between us. And the other thing is she totally understands the concept of treating a person whole body, not just individual parts, which is very important.
When I was in with you in your back room over at Pro, there was a number of things you showed me, but then there was also some like you have me doing a thing where I'm pulling and turning, and then the pole and the roller, but you also did a massage for me, and that was the first time that ever happened, like a mouth massage. That was interesting.
Right. So just knowing that those tissues have been painful and effective and dysfunctional for some time, working on getting blood flow to them and working their extensibility, and there's decompression. As you lengthen those muscles, you can decompress the joint and do some pain relief, and that is often a part sometimes of initial phase for a patient just managing their symptoms somewhat.
For people that are having the jaw and neck pain.
Makes it easier for them to function with the orthotic in, and quite frankly, the orthotic will register the change because the changes, the muscles, like Jamie just said, will be starting to lengthen and get to the right position, and the bite will change, and I can see that change and adjust for it.
And for the people that haven't been through or experienced any of this, what are we trying to change with the physical therapy component? What adjustments are we trying to make?
You want to take that one?
Sure.
Yes. I'll go after you.
So we have complementary vantage points, I think, and where I come in as a physical therapist is I like to view the temporomandibular joint from the socket orientation.
So right up by your ear.
Yes.
Okay.
So how the cranium is situated on top of the neck, and the upper cervical and the TMJ and the bite, as we know, all influence each other.
Yep.
And so I'm more coming at it from how is that upper spine and how the socket's oriented playing a role. So I want to optimize all of that position and ability to reach a good position and a functional base of support, so to speak.
And you said you wanted to go second, so I'm letting you go second.
The thing is, the thing about what we do with the orthotic is, and we did touch on this, is the orthotic is 5,000 times a day of functional bite position into these muscles that Jamie's working with. So it sets the stage. So you can't have a dysfunctional jaw 5,000 times a day and try to create stability. It can't work. So the components of both of what we do will complement each other. And then I can I can visually see a change in an orthotic based on how the patient bites, because it affects the jaw position with what I'm doing and the patient is doing 5,000 times a day, and what Jamie's doing to orient the patient in the proper three-dimensional position posturally.
So when I said my second orthotic, when I first had it, when I bit, I could feel a slide.
Yeah.
And then the slide kind of went away. Is that what you're talking about?
Right, because you're not your second orthotic, because there are usually two orthotics in treatment. The second orthotic is different than the first, and usually people see that second orthotic, they go, "Oh, it's going to feel just like the first." No, it's not. And I always warn them that, and I say, "But that's because you put in a lot of postural work and you put a lot of orthotic work in with the first orthotic, so you're not the same person you were 4 months ago." And if you look at their pain chart, they might come in with some pretty good check marks, but by 4 months, when we're doing the second orthotic, usually that pain chart's down to zeros and ones, really small. So it's real. So they've done their work, and that's why they qualify for a second orthotic. Plus, we've done the X-ray, so we can visually prove that head isn't in the same position.
Right,
that
and
it
you
was
can
4 months
physically
ago.
see it.
And
in
I
the X-ray.
send those X-rays to Jamie so she can see what's going on.
I always take snapshots with my phone when you're
you can
doing
do
your
that.
stuff.
You're the only one.
Picture.
Patients do
Yeah.
that, but we'll print them out anyway and give that to Jamie to take a peek at.
And Jamie, what you were talking about is, and what I think a lot of people fail to realize until they start getting involved in this kind of stuff is just how much is going on in that part of your body.
Yeah.
It's influenced by so many factors, all the way down to the toe.
Yep.
So
all your cranial nerves go through your head. And like we spoke before, the mandible is the densest bone, the teeth are the densest structures, your masseter is the densest muscle, because thousands of times a day you're utilizing your jaw to live your life through your face. I like that phrase. And so we have to make that pain-free, and that's a big deal. So that's why working together with somebody that's very qualified like Jamie is a real plus.
One of the other things that's very important is the doing therapy with the foam roller, and that's working more on the shoulders and head, correct?
Yes, and one of the goals often with the foam roller is using it in different ways around the thoracic area, which helping integrate spinal curves. Again, so your upper cervical spine can have a more neutral and more balanced position for the head to rest.
And we'll make sure on the podcast page we take some pictures and put them up there of some before and after for the spine and the head placement for sure. So if you're listening and you want to look at that, you'll be able to look at that and physically see the change, which is...
It's great to see. I have my own little primitive way of measuring because I work with the ear. I take it from the ear and I check down to the shoulders. And so we do that the first thing for a new patient exam, and we do that routinely when they come in and see what the changes are, and we can actually see how the shoulders are changing as well. There's always one shoulder higher. You can't get forward head without having a shoulder higher, which means one hip's higher, and Jamie sees all that stuff, and one leg is shorter. So that is what we are. That's what we see. I see it every time, and we have to change it.
And that was one of the things. One of the first times I saw you, we were doing the consultation. You rightfully predicted that I had left knee pain.
Oh yeah,
when you were working.
Well, you can kind of say, yeah. I mean, I've been, you can see these things.
Yeah.
Yeah. I had a guy yesterday that came in with his daughter who had all kinds of pain, and her face is his face. And so I said, well, but you're 20 or 30 years older, so here's what you have. And he goes, how did you know I had all that stuff? And I said, you're 30 years older than your daughter, so take your daughter out 30 years, she'll have the same thing unless we treat it, It's the asymmetries that we're trying to work with. Jamie's trying to create a symmetrical body, like we're creating a symmetrical bite position as well. So it's all the same. We're just working with different muscles,
And it's tying that. It does seem for the average person who just, ends up taking an aspirin or something for shoulder or neck or jaw pain, or just like, wow, I got to learn how to chew because I keep biting my tongue or the inside of my lip. They're focused on the symptoms. It's hard to correlate, like you said, all the way down to your toes. Could be affecting what's going on up in your jaw.
That's because you're looking at one thing. And I just remember a patient telling me, you're the first person that's looked at me as a whole person, not as one part. Because, like I said, looking at an anatomy book, it's all connected. So one part affects everything else. So we have to make sure we're covering the bases.
I don't have an anatomy book, but I'm guessing you have a lot of them, Jamie.
Yes.
And she looked like she wanted to say something. What did you want to say?
Well, I was just going to follow up on that in that our body is amazing and it has so many adaptive capabilities, right? We sometimes call them compensations or compensation patterns, but we can be out of balance or out of symmetry and be okay to a certain extent.
Right.
And I think sometimes working with the TMJ, it becomes which compensations, which asymmetries are really driving the pain condition, and how do we optimize those first or second, and coming up with those priorities, I think, is where having some experience and being an exclusive TMJ therapist, that's been where I think I can bring an advantage because of trying to understand and using some algorithm and systemic approach to figure out for each individual which things have to happen first or second to really have the best outcomes.
So I want to make sure I'm interpreting this right. A compensation pattern, that's how, okay, this is happening, so you start doing something different with your body to make that pain go away or be able to accomplish what you're trying to accomplish.
Precisely. Mm-hmm.
And then so that's how people start getting, that's where the shoulder's coming out of an alignment because your back feels better that way, or your head going forward feels better.
Many times we're not conscious of that happening. Our body just does it for us.
It kind of, it's smart enough to autocorrect and then just gets used to being in that spot. So then the physical therapy is reversing. Is it safe to say the physical therapy is reversing the compensation pattern or correcting it?
Good question.
Probably,
Semantics?
Probably both.
Yeah.
But the nice part is this isn't, it's not a cookie cutter because every patient is different. So that's why we work with that. And that's why Jamie's very good with that, because she understands that concept.
And I think it is important with that what you're working on in your office is important to have a partner like Jamie in her office that understands the mission.
And she understands what we do, so she understands what she needs to do. And, when you work together for a while on so many patients, and I think we understand where we're all coming from. So it makes it that much better for the patient, advantageous.
Mm-hmm. And that's part of the key is Dr. Insolera, and the way that he and I can communicate. He's generous with helping me understand his approaches with his time and making sure we're on the same page and receptive to ideas that I have. So it's really
no question.
It's really a integrated team approach, and I just love working with you, Dr. Insolera, about the way that we do that.
It's a win-win.
Is I can see the changes in our shared patients.
Yeah.
And that synergy is essential for success.
Yeah.
Jamie, thank you very much for joining us for the podcast.
Yeah, thank you very much.
Thank you for having me.